One of the biggest positive outcomes of the model is, in fact, promoting access to care and appropriateness to care and really keeping it patient-centered. The goal of the model is to increase quality of care and decrease cost at the same time. Cost has been a struggle, mainly because the biggest piece of that pie of cost is drug cost. And with rising drug costs, and folks are really hesitant about actually stating you can control drug costs. So how do you do that? And that's a different subject for a different time. But when you think about the other aspects of the model and what the ask is to drive down the cost, so really care coordination being one of them. The patient surveys that go out that the practices are actually adjudicated on and as part of the quality measures, there's questions specifically related to how well the patient is able to access their provider at any given time. Have they had a shared decision-making conversation with their provider? In fact, there's 5 aspects to that, 5 domains that they adjudicate on in that patient survey. One of them is access to care, and the other is shared decision-making. And that all lends itself to appropriateness of care and access to care. So in terms of how does it promote it? I think it's what it's rooted in, essentially, right? That's what's going to drive quality of care. So the right treatment at the right time for the right patient is one, and making sure that the patient is at the focus and is always able to access their provider, their staff, their navigator, anybody on their clinical team that they need to at any given time. So it's ensuring that that patient is taken care of, almost like a white glove service, if you will, for the duration of the program. And really, to practices' credit, I would say most all practices are implementing what they're doing for OCM across the board. So inadvertently, not just beneficiaries in this program are benefiting from this program, all patients are benefiting from this program.